many people think that knee replacement surgery is not successful. It is not good. You cannot sit cross-legged after doing the surgery. But these are all misconceptions.
Okay.
After knee replacement surgery, you can sit cross-legged. You can sit on a floor. Then the misconception is that the pain will be there even after the surgery. That is absolutely false. You can have a pain-free life after the knee replacement surgery.
Okay.
Yeah.
And how many successful surgeries have you performed till date?
I was counting till around 5,000, but after that I am
That's a big number. Welcome to V-Docs. My name is Ravya Sarda और जैसे आप जानते हैं हमारे शो पे we bring on experts from their respective field and today we have Dr Saurabh Giri with us who is an orthopedist with 14 years of experience. He's a specialist in knee surgery and he will share today insights on how to take care of your bones and how to keep your joints and bones healthy. So, hello doctor, welcome to our show.
Hello.
How are you doing?
Yeah, I'm doing great. Thank you.
Okay. So, doctor, एक orthopedist क्या होता है and what he does?
So, orthopedic surgeons are basically doctors who are specialized in bone health and joint care. Okay. So, any issues related to your joint, your muscles or bones is covered under orthopedics. Okay. So, as in you have many ligaments in your knee like ACL, anterior cruciate ligament, PCL, meniscus, all those issues related will be dealt by orthopedic surgeon. Similarly, any fracture or you have any sprain, all those things are looked after by orthopedic surgeons or orthopedic doctors.
Okay, and you have like a vast experience in this sector.
Yeah.
So, मुझे आपसे ये सवाल पूछना है कि when we talk about orthopedic doctors, you know, people have this misconception कि हड्डी के डॉक्टर के पास तो तभी जाया जाता है when you are in some sports or athlete या बूढ़े हो गए हो तब जाया जाता है. तो I would like you to clear few misconceptions here.
Like as you said, only old people come to orthopedic surgeon. That's not true.
Okay.
Those people who are young, those people also come to orthopedic surgeon because see, there, as you said, athletes they are young.
Right.
Okay. Secondly, even though you are not an athlete, there is a possibility that you may have a ligament injury like in your knee, or you may have some issues related to your ankle.
Okay.
You have while walking also you have missed a step and you have sprained your ankle,
Right.
or you have injured your knee. Then you need to see a orthopedic surgeon. Okay. There are many misconceptions about the orthopedics, like mainly related to the knee surgeries, like knee replacement surgeries. Like many people think that knee replacement surgery is not successful. It is not good. You cannot sit cross-legged after doing the surgery. But these are all misconceptions.
Okay.
After knee replacement surgery, you can sit cross-legged. You can sit on a floor. Then the misconception is that the pain will be there even after the surgery. That is absolutely false. You can have a pain-free life after the knee replacement surgery.
Okay.
Yeah. So these are the main misconceptions around the knee surgery. That's why people delay them. And then one problem leads to one more problem.
Okay.
Like you have a knee issue, your gait will change, that will lead to your spine problem. So one problem brings one more problem, and then your lifestyle and everything goes down. So,
but how does this problem occur? आप जो बोल रहे हैं कि one problem leads to another.
Yeah.
So ये कैसे arise होता है?
see, अगर आपको नी में पेन है, ओके, तो उस पैर पे आप वेट बेयरिंग जो है वो अवॉइड करोगे.
Right.
देन योर गेट विल शिफ्ट. आपका गेट एक साइड में शिफ्ट होगा. यू विल वॉक लाइक दिस. देयर विल बी अ लर्च इन योर गेट. व्हेनेवर यू आर लर्चिंग, योर स्पाइन मसल, वन साइड स्पाइन मसल्स आर गेटिंग पुल्ड.
पोस्चर चेंज हो जाता है.
So this will lead to a spine issue. One side of joints in the spine, facet joints we call them, they will bear more load. Then they will develop the arthritis. Then you will have constant back pain.
Okay.
So this is how one problem leads to another problem. Many young patients with the hip issue, because of COVID nowadays, there are many patients who are coming with AVN. AVN is in avascular necrosis of femoral head, wherein your hip joint, hip bone is getting dead because the blood supply is not enough.
ये young generation में हो रहा है.
This is happening in young people around 26, 28 years, 30 years old.
Okay.
Because of COVID. See what happened in COVID? COVID itself caused the thrombosis. Okay, and then to prevent the damage to the lungs and other tissue, we gave the steroids to many patients of COVID. So this combination that COVID was causing the blood clotting, and we were giving steroid has caused the damage to the blood supply of hip bone. And nowadays many young patients are coming with the problem with the hip or vascular necrosis. So before COVID, when I used to do hip surgeries, the number was used to be somewhere around 3 to 4 surgeries in a month.
Okay.
Then now the number has gone to 15 surgeries in a month.
That's a lot of
number, so and there are many people who are still avoiding the surgery because of fear of surgery.
Okay. So, but do you think there is also this misconception कि बैठने की वजह से भी if you sit for long hours आपके बैक में तो पेन होता ही है बट हिप में भी प्रॉब्लम होता है. Is this is also a misconception?
No, back pain is definitely can happen with a long if you are sitting for a long duration. But work ergonomics has to be followed. Like you have to have a proper back support. Reclining chairs are not at all good. If you recline, your back muscles are in a constant work. That's the body's protective response, because you sense that your body is going behind.
Right.
Then the muscles will contract. So again the muscle will contract. Then
so
you
recliner chairs are not
good at all.
Okay, and people think that recliners are always best for them.
Yeah.
Right.
So any chair with a stable back support is important to avoid the back issues. Secondly, the work ergonomics, that your screen has to be at a eye level. That is also very important to avoid the neck issues. So we don't follow work ergonomics.
Things,
but these are minor things and they make a lot of difference.
Correct.
Like in a good designed car, the ergonomics are spot on and you don't feel tired. But on the other hand, if a car is of not that great brand, you will feel tired after driving, say, around 40-50 kilometers only.
Correct.
So that is how ergonomics work. So similarly, while working, if you have good ergonomics, then definitely your back issues, neck issues can be avoided.
Right. So doctor, you have told us about the misconceptions, the sitting posture, कि क्या important है. But ऐसे कौन से warning signs होते हैं that an individual should realize कि अच्छा these are the warning signs और अब time है कि मुझे एक orthopedist के पास जाना ही चाहिए.
Okay. So if you are having a swollen knee or any joint which is having swelling, that is one warning sign. Secondly, if you are having constant pain while walking in any of the joint, that is one more warning sign. Okay. And if you are avoiding, for old age people, like they have a habit of avoiding doctors. Okay.
Yes.
So if you see your parents or grandparents are like restricting themselves to the room, so that is a sign that they need to consult an orthopedic surgeon.
Correct. Okay? But these people need to go out at least for a walk जब हम older generation की बात करते हैं.
See, what happens, because of knee pain they are not walking. So they have a knee pain, that's why they restrict their life or whole thing to a room or to a house.
Correct.
Okay. So to make them walk and do, you need to change the pain in the knee. Okay. You have to address the knee pain. Okay. If you can address the knee pain, they will walk, they will move out of the house, they will be part of a social life also.
Right.
So to address the knee pain, you have to visit a doctor.
Right. So these are the warning signs when one should visit. And when we talk about orthopedic surgery, right? तो ऐसे कौन से aspects हैं which are like important in an orthopedic surgery?
Any orthopedic surgery, mostly it is related to a bone and a joint. So bone and joint has a major role in weight bearing and immobilization. Okay. So the alignment of a bone and alignment of a joint is the most important part for any orthopedic surgery. If you consider a knee replacement surgery, placing the implant in a proper alignment has a major role in the success of a surgery. Okay. Similarly, if you are doing a ligament reconstruction, putting a new ligament in a proper position, then only it will last long. Otherwise, even if you reconstruct a new ligament, and if it is not placed properly, then it will fail. Okay. So the alignment of any bone, any joint, any ligament to its original natural position is very important for a success of a orthopedic surgery.
Correct. Yeah. Okay. Doctor, you have been in this sector since 14 years, right? And how many successful surgeries have you performed till date?
I was counting till around 5,000, but after that I am not.
Big number.
I am not counting.
So ये कब count किया था 5,000?
I started from a PG, since I did my first surgery post graduation. Okay. Till then I was counting. I have this Google Calendar. I used to maintain my Google Calendar. I did one surgery. And now when I came to Pune around 4-5 years back.
Okay.
After 1 or something year, I stopped doing that now.
Okay.
Yeah.
So ये आपने तब किया था?
Around 3-4 years back. Yeah.
काफी और नंबर बढ़ गया होगा अभी तक, right? Yeah. Yes. It's numbers of years of practice that you're doing. तब medicine अलग था, अब medicine industry अलग है.
Yeah.
So what changes you're looking into this sector? What are the developing changes you have seen in medicine industry?
Yeah. So medicine industry is evolving. The way we perform surgery is evolving. Okay. Like robotic was not in there, robotic knee replacement was not there 5-7 years back. But now the advances in a robotic has gone to the level that the surgeon has to open the joint, mark it so that the robo can understand where is the bone, and everything can be done by a robo now. And that too with the precision, absolute precision. So this is how the orthopedic is growing.
Okay.
The role of robotic surgery in orthopedic will keep on growing. Even with the ligament reconstruction, it will come. Then secondly, whenever there is a cartilage issue or anything, there were not many options to regenerate it. But now the biotechnological advances has made it possible that we can regenerate the cartilage.
Right.
Then the expectation of patient is also changed. Okay. So
how has the expectation changed here?
Yeah. Well, see, initially the patient was not that on a fast moving life was not there. So they were okay to stay in a home for 15 days, 20 days. But when I do a ACL reconstruction now, the first thing they want to know when I can join the office.
Okay.
Yeah. So can I join in 5 days, 7 days, 10 days? Because nobody can stay in a home for a longer period.
Right.
So with that we have newer advances. To meet those demands, we have an internal bracing which can allow you to walk within next day of surgery. So this is how it is evolving. When after doing a knee replacement, initially we used to keep the patient in a bed for 2 days.
Okay.
Now I make them walk within 24 hours of a surgery.
Oh, this really happens? After the surgery, 24 hours?
Yeah. Now the concept is changing from 3-day surgery to 1-day surgery.
Okay.
In UK, it is being practiced right now that even in some part of India, though not that level, that we discharge a patient within 24 hours after doing a knee replacement surgery.
They are like healthy, fit and fine.
Yeah. That is how.
That's a wonderful thing. That's the advancement and innovations.
These are the advancement in a pain management, the way we perform the surgery, and the patient selection is also important. Okay. So these are the advances which are coming up, and this is the future for orthopedic surgery. Okay.
But when a patient comes to you, is it difficult for you to explain them about the robotic surgery? I mean, they readily agree. It's important to educate them.
They know more than me nowadays. They do a lot of research. They know what is navigation, what is robotic, what is robotic assisted. Everyone is doing a Google and they know everything.
Yes.
So when I tell them that it's robotic surgery, fully autonomous robotic, they do understand. Okay, and those who don't understand, they have faith on doctor.
Right.
So when I tell them you need to go for a surgery, they are quite okay
they're
with
good
that.
to go.
Yeah.
But we are talking about robotic surgery here. What is robotic surgery? इसमें सच में कोई robot है आपके साथ to do a surgery? What is this all about?
It's not a humanoid robot kind of thing. It's a robotic arm. Okay. Which has a burr attached to it, which cuts the bone. Okay. So I will open the knee joint, separate the soft tissue. The bone will be exposed. Then the bone will be marked. Okay, with the marker. It's kind of sensor. Okay, and that will be picked up by robo. Okay, before doing we do a CT scan of that patient also. Then we know how is the bone quality, what is the structure of a bone, what is the shape of a bone. All these details are fed to a robo. It's there. We perform the surgery. Before performing the surgery on a patient, we will cut the bone on CT scan model. 3 mm, 4 mm bone is cut, 5 mm bone is cut, 5-degree angle is set. All these things are done before performing the surgery on a patient. Right. Then we'll see with this kind of bone cutting, we will fit this implant and how is the alignment of that implant. Everything is done before performing
the surgery.
Yes, actual surgery is performed. Yeah. So that is how the precision is achieved. Because see, I do conventional knee replacement. I am doing it since many years.
Correct.
Results are good.
Correct.
But still I'm willing to accept the robotic is because it has more advancement. My eye cannot differentiate between an angle of 4 degree and 5 degree. It's very difficult for any person on a bone to decide 5 degree, 4 degree angle. That can be done with robotics.
Okay.
So that is a precision which we can
but
achieve.
As we say, na, change is important.
Yeah, change is important.
Correct. So if I may ask about the robotic knee surgery, so cost effective hai ye?
At present, if you compare with the conventional, it is a bit costlier because see, when you are using a burr, okay, that has to be changed every patient. Then you have to cover the robo with the sterile packings and everything.
Right.
Then the robo itself is very costly. So the compared to the conventional, cost is little on a higher side. Definitely the cost will come down as the technology will advance, as the many people will have robo. The cost will come down. But when you look at the advantage of it, that the soft tissue dissection is minimal, the pain post surgery is minimal, precision in the implant placement is more. Okay. So when you compare the cost with this benefit, I think it is cost effective.
That is cost effective.
Yeah.
और दर्द होता है?
See, if I say no, that is absolutely false.
Right.
Okay, any surgery will have pain. But as I said, we can discharge the patient within 24 hours of surgery. That is also possible.
Correct.
So with the new methods of pain control and everything, the pain will be significantly less. Patient will definitely walk within 24 hours of a surgery. Okay. So any surgery will produce the pain, but the pain is not that it is unbearable or something which you cannot go through.
Right.
It is bearable.
And as you're saying, if a person is able to work within 24 hours, तो bearable pain नहीं होगा. But जब हम conventional surgery और robotic surgery की बात करते हैं, as compared, हम results की बात करें, तो robotic surgery के results कैसे हैं?
Immediate results like a pain, okay, and the alignment of implant on the basis of X-ray and everything are far better. Okay. Long-term results are also good. Okay. They are even better than the conventional. Okay. Okay. But see, the normal knee joint lasts, when you do a knee replacement, it lasts for 25 to 30 years. Okay. So the robo which we are using, it is not 25 to 30-year-old. Okay. So saying that it is absolutely going to produce major difference, it's not correct at this point of time. Okay. But when you look at the placement of implant, when you look at the precision in cutting the bone, it is far better than the conventional surgery. And these are the things which makes the longevity to go up. Correct. The time for which the knee joint will function more effectively will increase with this. If this is good, right. So definitely if this is good, that will also increase.
No, because I was asking, the main reason was because जब Google search किया ना, I'm also a common person, right? Yeah. Like regular ones. Yeah. Google search किया तो Google search में 100% Google कहता है 100% results है robotic knee surgery में. Yes. So from a doctor's perspective, I would like to know, like, ये correct है?
Knee replacement with a robotic is as successful as a simple cataract surgery. Okay, more than 95 to 98% success rate. Why I am saying that 95, 98? Because there are few things which are not under doctor's control. That out of 1,000, one will get infected. That is a possibility. Okay. Then out of 1,000, 2-3 will have some complication related to the thrombosis in the vein. Okay. For that, we do have a preventive measures like giving the antibiotics, giving the blood thinner and all those. But still, those things cannot be avoided. Okay. So that is a very unfortunate that can happen with any surgery. But the benefit which it brings in your life, that is important.
Okay. Okay. So, but here one question is very important. जैसे surgery हो गया, in 24 hours में आपने patient को कहा कि आप जाइए अपने घर, you can go to the office also. What are the precautions that one is supposed to take? There must be few precautions, right? खाने में, diet में, walking also. Yeah.
So knee replacement we don't discharge right now within 24 hours, but ligament surgeries we do discharge within 24 hours. Okay. After that, there are set protocols of physiotherapy which needs to be followed. Right. Okay. Those we normally give it in a booklet where inpatient can see and do the surgery accordingly. Secondly, after any surgery, the diet has to be protein rich. Okay. So because protein is important for healing, it's a building block of body. So protein rich diet is important, low carbohydrate diet is important.
Okay.
Okay, so that is the what is needed after
Okay.
the surgery.
But ये robotic ही क्या, but conventional के लिए भी यही precautions है जो that should be taken care of, right?
Yes, yes.
But doctor, आप जैसे कह रहे हो कि 24 hours में a patient can go to work or go to his place or go to the job. बट ये क्वेश्चन मुझे ही नहीं सभी को होगा आई बिलीव कि 24 आवर्स जब आप स्टिचेस करते हो, ये कैसे पॉसिबल है कि इतने स्टिचेस के साथ आदमी उठ के जा रहा है काम करने के लिए?
24 hours to go to work, that is possible for a ligament reconstruction surgery. In which there are hardly 1 or 2 sutures. Okay, and those are very small incision, around 0.5 centimeter incision, which we
that's not painful.
That's not painful
Okay.
for a ligament reconstruction surgery. Coming to the knee replacement surgery, we make patient walk within 24 hours of surgery,
right?
And that is possible because see, we do give us a good number of stitches inside, okay, over the tendon. Okay, and
Right.
tendon can hold the sutures very well. Secondly, the skin closure is done in 3 layers. We do the suturing for the fat area, then subcutaneous, and then over the skin. So these are the 3 layers where we stitch the skin and subcutaneous tissue. So that can hold this skin together. Even if you flex the knee to 90 degree,
okay,
it will not open up. It will never open up because
क्योंकि ऐसे ही अगर आपका एक्सीडेंट हो जाता है, खरोच यहाँ पे अगर स्टिचेस लगते हैं, if you bend your knee,
okay.
तो वो खुल जाता है.
Okay.
बट आप कह रहे हैं कि इसमें नहीं होता है.
इसमें नहीं होता है. And secondly, to control the pain, to make the patient walk within 24 hours, we give a local infiltration of analgesia. Okay, we inject multiple injections which are anesthetic, which will numb this area only for 48 hours. Okay, and then along with that we give some medications also which will control the inflammation in here, and that will reduce the pain and everything. Okay.
But are there any side effects?
For local infiltration?
Correct.
No. But see, any medicine can produce an allergic reaction that we don't know.
Right.
Okay, but local infiltration as such has no side effect.
Nothing, right? And when we are talking so much about robotic knee surgery is the future, right?
Yeah.
And but why should one consider to go for robotic knee surgery? Conventional भी तो है.
Okay, so as I already said, the knee replacement with the robotics has a better way of doing it. Is a better way of doing it, as well as the precision in placement of implant. The precision in bone cutting is far better than the conventional surgery. So that's why it is always advisable to go for what is better. Okay, so if you buy a car, if you have an option of buying a Mercedes, you will go for Mercedes.
Right.
Yeah, so it is like that. Luxury as well as it produces the beneficial effect. A car without a airbag is dangerous. Car with 2 or 6 airbags is always good. Okay, so that is how it is. And secondly, why anyone should consider a knee replacement surgery? Because many of time people ask me why I should go. Even their son, daughter, they will ask me why she should go. She's old. Then I ask them what is her routine in a day. They'll say she doesn't do anything, she sits in a corner. So I said, can you sit in a corner of a home? Can you enjoy that life? No. Then why she should be like that? She or he should be like that. So what happens with the old age people, it starts with the knee pain. They'll take some local medicines or anything, some physical therapy. Then they will restrict themselves to the house. Then they will restrict themselves to the room. So, and they will become socially isolated slowly. If there is a function, they'll say, you go ahead, I'll not come. They'll not say, I am having knee pain because that's why I'm not coming.
These are the small things, right? But हम लोग ध्यान नहीं देते हैं इन चीजों पर.
But then slowly that patient becomes socially outcast because of knee pain. She's not going anywhere. She or he is not going anywhere. And that leads to a depression.
Yes.
Then that patient or that person becomes isolated. So if you want them to be part of your family, want them to be social, they need to be up and moving.
Correct.
Okay, and to be up and moving, you need to address that knee pain, that knee deformity. Okay, once you address that, they will be part of every social gathering, every family meetings and everything, and then the whole family changes. So it is not a disease for one person, it is a disease for a family.
Entire family. We are talking of everything about the good aspects of robotic knee surgery. But ऐसा कुछ है कि इसकी भी shelf life है कि ये इतने साल तक ही अच्छा रहता है, and then you have to go again for the checkups.
So,
या रेगुलर चेकअप कराने जरूरी होते हैं इसमें?
As per the data available, we can say the life of a knee replacement, robotic knee replacement, is somewhere around 30 years.
30?
Yeah.
So that's a good life. Yeah.
And mostly we perform a surgery in somewhere around 60 years of age.
Correct.
So that solves the purpose for whole life.
Yes. Yeah. So and what about the checkups in between? आना पड़ता है फिर बाद में एक बार?
Checkup is after the surgery. There will be one checkup on 14th day to check the sutures and everything. After that there will be one checkup after 1 month and done. There will be no more checkups.
फिर 2 साल 3 साल बाद you don't have to come.
Not needed.
A person can go for walk.
Yeah.
Run.
They can come down to say hello.
Yes. तो मतलब भाग दौड़ सकते हैं आराम से, right?
Yes.
Okay. ये हमने काफ़ी सारी बातें कर ली about knee replacement and robotic knee replacement. Coming down to the question at the end, this is the end of our show. But जाते जाते what would you like to share to our audience, or few tips to take care of their bones and joints? क्या करना चाहिए?
So first is diet. Okay. What is happening with every one of us? We eat too much cooked food.
Right.
Okay.
India में तो सब overcook है.
Yeah, it is overcooked. So that is where the nutrients get lost.
Right.
Okay. So having a green leafy vegetables, having them raw is very much important for your body. Secondly, we are moving towards a sedentary lifestyle. We have remotes for everything. We have Alexa for everything.
We have remotes for lights.
Yeah, we don't get up also to turn on the light, right? So that sedentary lifestyle is leading into osteoporosis.
Right.
Okay, that if you keep your bones and joint loaded, make them work.
Yeah.
If you are using them frequently, they will stay healthy for a longer duration. If you are not using them, they will become weak. They'll have issues. So maintaining a healthy lifestyle, exercising, walking, and having a raw food like uncooked or partially cooked food.
You can have salads also, right?
Correct. So that is also important for a good health as well as a bone health.
For bones, right?
Yeah.
And जो आप कहना चाह रहे हो यहाँ पर, that don't be a potato couch, because this is what generally we see कि एक जगह बैठे बैठे सबको remote से switch on switch off करना है.
So you go to office, you are sitting there. You come back home, you are sitting there on a couch.
Correct.
So in between there is very less movement.
Right.
So that is why we are seeing patients in 40s, in early 50s. They are having osteoporosis. They are having knee issues, knee pain.
Correct.
So if this cycle is not checked or broken, then the number will go up very significantly.
Yeah.
Okay.
So thank you, doctor. Thank you for coming on our show, sharing us these extremely innovative and insights on knee replacement. And I think our audience will also gain some knowledge from this. तो जैसे कि डॉक्टर ने कहा, don't be a potato couch. You have to take care of yourself. Eat healthy, walk, take regular breaks, sit properly, do your work properly. This is very much important. So until next time, see you.